Good morning, respected faculty members. The study of is clinical profile of tuberculosis meningitis in the children with a special reference to neuroimaging. My name is Dr. Achal Raval from uh, uh, second year BJ Medical student. TB is the infection.
Aims and objectives.
To study the incidence and the clinical feature of the tuberculosis meningitis in the indoor pediatric patient admitted at our hospital, and the other is observe the various neuroimaging findings in the tuberculosis meningitis patients. The study period was 1 year. The study is retrospective observational study. All patients from age 1 to 12 years are included in this study. Total 52 patients are diagnosed with the tuberculosis meningitis in the patients with the prevalence of 0.5 and incidence was 1.1 in these patients. There are equal number of male and female patients diagnosed in this study, which is 26 out of 52. The as the age advances, the number of patients diagnosed with the TBME is more. The most common group is 6 to 12 years, followed by 16 in the 3 to 5 years, and followed by 1 to 3 years. Fever, convulsion, and the vomiting are the most common presentation in these children's. The CNS sign, the most common signs are hypotonia, abnormal movements, and the meningeal signs. There are more 73% patients diagnosed with the anemia, and ESR was elevated in 100% patients. In neuroimaging finding with MRI and CT scan, hydrocephalus is seen in 48 patients, followed by the periventricular oozing seen in 37 patients, and leptomeningeal enhancements is seen in 32 patients, which are most common findings in this study. As the age advances, the number of patients with death ratio increases. It is most common in 6 to 12 years of age. To summarize my study, overall prevalence is 0.5 with incidence is 1.1. The maximum number of the tuberculosis meningitis case were in children less than 5 years, with toddlers age group where 15 younger children are the most vulnerable for disseminated TB. Most common presenting symptom is fever followed by convulsion, vomiting. Hypotonia is found in the 75% of patients, with meningeal irritation in 73% of patients, and followed by the abnormal movement in the 57% of the patients. Raised ICP is seen in 48% of the patients. In the neuroimaging study of the patients, the hydrocephalus is the most common finding seen in the 92.3%, followed by the periventricular oozing and the leptomeningeal enhancement seen in 61.5% of the patients.
Okay. What is the neuroimaging of choice? You are suspecting TBM.
Sir,
CT with contrast, MRI with contrast. Choose one. I'm suspecting TBM, 5-year-old child. Choose between CT with contrast, MRI with contrast.
MRI is the modality of the choice for the.
I'm not interested in contrast. You need to choose one. Okay, you stick to MRI. Okay. What are the tests in CSF other than routine micro that you can diagnose TBM? Other than routine micro, tests in CSF.
The CoWeb formulation.
That's routine micro, CoWeb. How many MDRs you found? Rifampicin resistance amongst these?
This study not put the.
You have excluded the resistance ones. How did you pick up resistance that you?
That it is your children had abnormal movements. Was it abnormal movement or convulsion? And which type of abnormal movements?
Ma'am, posturings.
Posturing doesn't
Posturing
come
is an
under
in
any
involuntary movement.
abnormal movement. What are the types of abnormal movement you know?
When upper limb flickering or that.
Okay, done.